This video is for basic facial, and so we always start basic facial or any service as we first get to work. So the first thing that we're gonna do is wash our hands. So we'll go to the sink, we'll wet our hands, we'll get a coin-sized amount of liquid hand soap. We'll wash our hands together down to our wrists. We're gonna wash the back of our hands down to our wrists. We're gonna wash our fingers, and we're gonna wash the back of our fingers. We're gonna wash our fingertips and our nails. We're gonna wash between our fingers and our thumbs. We're gonna wash our thumbs. We're gonna wash our wrists, and of course we're gonna do all of that interlocking wash for a minimum of 20 to 30 seconds. And then we'll give everything a proper rinse under the running water. When we've thoroughly rinsed, we'll grab either disposable paper towels or a towel to turn the faucet off, dry off our hands completely. Paper towels go in the trash. The towel will go in a closed container until time to do the laundry. Then we get our hand sanitizer that is 70% ethyl alcohol. We sanitize our hands, doing all those same movements. Just gonna grab a quick sip of water here. And then we can go ahead and prepare our room for our client that's coming in for a basic facial. Most important thing to note is we always do everything we can before it's our client's appointment time. We want to have everything set up and ready to go before they arrive so that we're very prompt on their appointment, as well as their appointment and their schedule, as well as our schedule. Everything needs to be done so that their service time is allotted for service and not set up or breakdown. So we're doing our best to be very mindful of that and punctual and professional. So we're going to get our room ready. We're going to disinfect our workstation, bed, and equipment using a disinfectant wipe following manufacturer's instructions. We're going to check equipment to ensure that all devices are in safe working order and plugged into a working receptacle. We'll gather clean supplies needed for the facial service, storing in a clean, closed container. We're going to turn on the hot cabbie and stock it with at least 3 clean wet towels. More may be needed depending on the service and client's needs. We'll fill clean steamer glass with distilled water and preheat the steamer. We'll dispense products needed for the service according to the skin type and client's needs as follows. We'll prepare disposable portion cup tray for each product with a portion of the product by opening the top of the container and ensuring the tip of the nozzle does not come into contact with the disposable portion cup tray, or remove the product with a disinfected or clean single-use spatula. Close the lid with the product and set the portion cup tray on the tray. We'll drape our facial bed using 1 fitted sheet, 1 flat sheet, and 3 towels. Place clean laundered sheets down on a disinfected facial bed, placing a towel horizontally at the head of the bed. Lay a hairnet and headband on top of the first towel, along with a rolled towel to support the head and neck of the client. Save the third towel to lay across the client's décolleté. So we've set all of that up, and what we're going to review now is what we have on our tray. If the client is not an existing client, you can at least have everything out that you may need to dispense at the time of the service, but you can put out almost everything out ahead of time. So on our tray, of course, we have 4x4s, 2x2s, cotton rounds. We've got disposable gloves for extractions. I've got toner. My toner's a spray. I've got water, makeup remover, astringent. I've got cleansing, exfoliating, a mask. I've got massage product. I have wooden stick Q-tips because I would use those for extractions if needed. I have a brush to apply mask with. I have mirror. I have eye cream and moisturizer. All the things I could possibly need on my tray set up and ready to go. So once we know that everything is prepped, we are then able to move forward with the next step, which is client consultation for the basic facial. So just noting here that you saw me wash my hands earlier. I'll wash my hands again before time of service. I would always have clean hands when I approach the client. So my hands are clean, and then I can go and meet my client as they arrive. And they're arriving promptly at their appointment time, which is amazing. So we're gonna go greet our client and escort them to the work area. We're going to determine our client's preferences at this point in our conversation, and we're going to assess the client's needs. We will assess the client's skin by performing a skin analysis to ensure that there is no inflamed, infected, broken, raised, or swollen skin in the area to be worked on, or an open wound or sore in the area to be worked on, infection or infestation like lice, to prevent from safely performing the service. And of course, we're doing this with our eyes during the conversation. we're going to assess the client's consultation form, which they filled out, and you've had them fill out upon arrival. So you're giving them a few minutes to get this client form filled out, or they filled it out online maybe ahead of time, so that you can review it and really take some time here to meet your client if you don't already know them, and just discuss these details that are really important. So you're going to assess the client's consultation form for any medications and products that they've used within the last 72 hours. So that's important because medications can affect the condition of the skin, or also how the skin may respond to services or products that are applied topically on the skin. So you need to know what's happened within the last 72 hours with that, and then you're going to consult on any known allergies. Of course, if they're allergic to something and it's an ingredient in one of your products, you would never use that. So that's important to know ahead of time. You'll consult with client on any facial surgeries that they've had within the last 3 months, and if the client is under a physician's care. Obviously that's important because you're going to be working on the face if they've had facial surgery. You'll assess if the client is prone to cold sores or fever blisters. So if they're prone to them, you have to be mindful and careful. If they have an active cold sore, you cannot perform any kind of service on the client. Incredibly contagious a fever blister is, so you don't even want to go there. You'll assess if the client has used exfoliating or lightening agents within the last 72 hours, like alpha hydroxy acids, beta hydroxy acids, hydroquinone, etc. Those are incredibly powerful ingredients, and they can definitely make the skin extremely sensitive to the service and also products, and you would not want to perform a facial if they've used any of that within the last 72 hours. You'll also assess facial injections within the last 3 weeks, like Botox or hyaluronic fillers. You wouldn't do the facial if they've had that. You don't want to move anything around. It's not supposed to be moved around. So they need to get past that 3-week window before you can do that. And if your client is free from any of the above contraindications, you can move forward with the procedure. Thankfully, our client is good to go. So that's client consultation, is where you really take some time to make sure you understand everything the client is trying to tell you. Also, that's where you're going to learn their goals. You're going to learn what skin type they think they have, or challenges that they may want to work on. And then you'll be able to gauge that when you do the professional skin analysis in a few minutes, if you do get to do it. So making sure you take the time there, and then moving forward. And if you don't know something, you just look it up. You talk to them. You're talking to them in a more private setting anyway, and now you're going to get them into a private room in that intimate setting for the facial. So you're just going to go ahead and move the client into that private area. Everything is laid out on the facial bed, and then you'll leave them alone so that they can change into the drape, have that privacy, and then get into the facial bed. So they've done that, and then you come and knock on the door. When they give you permission, you can then return in the room and help them get more comfortable. So they are on the facial bed. You're just going to make sure they're tucked in. You will go ahead and give them the next level of comfort. So we've got an additional towel here that we're going to cover up the client's décolleté with, maybe a little blanket, just so we're not getting anything wet. We've got a roll towel that we're going to place under the client's neck for additional comfort. And then we have a headband so that we can keep the client's hair out of their face while we perform the service. And we won't get any product in their hair. So taking the time to do that. And then while they're there getting comfortable, you just make sure everybody's comfortable. You will wash your hands before beginning the service. So you go to the sink, we wet our hands, we get that coin-sized amount of liquid hand soap, and we wash our hands down to our wrist. We wash the back of our hands down to our wrist. We wash our fingers, and we wash the backs of our fingers. We wash our fingertips and our nails. We wash between our fingers. Between our fingers and our thumbs, we're going to wash our thumbs, and we're going to wash our wrist. We're going to do all of that interlocking cleanse for a minimum of 20 to 30 seconds. Thoroughly rinse everything underneath the running water. Grab disposable paper towels or a towel to turn the faucet off with. Dry your hands thoroughly. Paper towels are going to go in the trash. A dirty towel will now go in a closed container until it's time for laundry, and then you get your hand sanitizer, which is 70% ethyl alcohol, and you sanitize your hands. And then once your hands are sanitized, you're ready to begin the service of the basic facial. So we're going to remove our client's makeup. And some clients will have on more, some clients will have on less, depending on if they're coming from work, if they're home, if they're makeup kind of person or not. So just take the time to make sure you get it all off. And then we'll do the first cleanse on the client. And then we'll remove the cleanse. And then you're going to explain to your client that you're going to be bringing in a very bright light. So you want to cover your client's eyes, which I'm going to do right now, because you're going to perform your professional skincare analysis. And you'll be bringing either a magnifying light in or a Woods lamp. And so you need to make sure that you're protecting their eyes. And so you're going to bring, once their eyes are covered, bring the light over and turn it on. I don't have one of those, so I'm just going to talk you through it. And so this is where you're going to look through that magnifying lamp, and you're going to be able to do a real proper skin analysis. So you want to take some time here. This is where you're going to do your best to learn about your client's skin. Certainly, your client has shared with you their concerns or why they've booked this appointment, what their ultimate goals are with their skin health or what they're trying to improve or achieve. So you're going to look for those things. But you're going to also look for what you really think is happening, and then ways that you can not only improve their skin through service, but also through a home care regimen recommendation, because you know that they're at home more than they are with you. So you're going to look for different things in different areas of the face. Maybe cheeks, it's pore size; chin, maybe it's congestion, excess sebum, could be all of that. You could be looking for dehydration, fine lines and wrinkles, hyperpigmentation or redness, certainly capillary issues. You're going to look for freckles, moles. You're going to really analyze everything, and you can discuss everything with your client at the same time. This is really an important time for you to make notations, because when the appointment's over, you're going to go back to that client card or your software system, and you're going to be putting details in that regarding your client's skin, what's happening with their skin, what you see on their skin, what you're working on with their skin, so that you can always notate every appointment improvements or challenges. Also, you're going to notate products you used, products you recommended, products they go home with. So you keep some very detailed records. That way, if you ever see any changes, like I said, for the better, for the worse, or maybe there's a change in a freckle or a mole, maybe you're the first one to identify that, you're going to be able to refer them on to a physician for something that may be out of your scope of practice. So really take some time here to do what you need to do. When you're done, you can turn the light off, move the magnifying lamp away, and then you'll be able to remove coverage on the client's eyes. And you would go on to then cleanse number 2, which is what we're going to do right now. And then you would go ahead and remove cleanse number 2. Not really sure why my light is flickering on and off, but it is. And then you have the third and final cleanse. And sometimes you may not need to do this, but for our client, we need to. So we're going to go ahead and do it. I'm going to fix that in just a minute, you guys. And then we can remove that third and final cleanse. And then we're going to tone. So we're going to take some 2x2s here and we're going to spray with our toner, but we're not going to let that nozzle touch the little squares. And now we're going to exfoliate. And so I'm going to take a pea-sized amount of exfoliant and I'm going to spread it out a little bit around the face and neck. And we're always going to avoid, with everything that we do, of course, the eyes, the nose, and the mouth. And then we are going to massage it in for 1 to 2 minutes. So you want to just read and follow your manufacturer's directions, of course. There's chemical exfoliants, there's physical exfoliants, there's all different ways to exfoliate. So with this one, basic facial, we're just going to use this kind of physical exfoliant and we're going to massage in for 1 to 2 minutes. when you've finished massaging in your exfoliant, we're going to go over what happens. I don't have that equipment here, so I'm going to read you through it. You will retrieve the steamer and turn it on. You're going to position the steamer next to the facial bed. Make sure that it is facing away from the client as the water heats up and emits an even outflow of a mist. Once the steamer is emitting a mist, you're going to position the steamer 16 inches over the client's face and aim it at the chin of the client for even distribution on the face, allowing the unit to function for 3 to 5 minutes. Remove the steamer from the client's face, return the steamer to its previous location for disinfection. So you're going to find that steamer, the one that you put that distilled water in and you preheated before the client even arrived, and you're going to bring it over to the side of the facial bed. You will turn it on, making sure that it is facing away from the client. And then it's going to start to do that little even mist outflow. Once it's got nice and even, you can turn it towards the client's face, positioning it towards the chin. It can be in either area. Just make sure it's that way, 16 inches above the face, so it can really steam the client evenly across the face for 3 to 5 minutes. Obviously, we don't have the machine and we're doing a video, so we're not going to wait here for 3 to 5 minutes, but we've done that. Then we're going to turn the facial steamer away from the client, turn it off, and then put it back where we got it from, and we'll clean it and disinfect it after the service is over so we can get back to what we're doing. So we're going to get a towel out of our hot cabbie to remove the exfoliant, and I don't have a hot cabbie either, so I'm going to pretend like this is my hot towel. And I'm always going to check the temperature on my wrist. It feels great. Checking the temperature on my client's collarbone. She says awesome. So I'm going to apply that hot steamy towel to my client's face. I'm always going to leave the nose out so my client can breathe. And you'll start to feel your towels start to cool down after about 20 to 30 seconds. So once you feel that like cooling set in, you can start to remove the exfoliant at that point. So you don't want to leave that towel on too long. And then once you have removed all of your exfoliant, you will be performing extractions if your client needs any. And she's got a little congestion around her nose that we're going to work on there. So make sure you dry your hands off really well, because you have to put on disposable gloves to perform extractions, and that can be hard to do if your hands are wet. And there's a couple ways that you can perform extractions. You can take 2 cotton rounds and you can soak them in astringent and wrap them around your fingers and kind of perform your extractions, working your way around the cotton rounds and then tossing it that way. I'm going to use wooden stick Q-tips, and for that extraction process, you would soak 2 of them in astringent, and they would remove, or you would perform 1 extraction, and then you would toss and get 2 more, another extraction, etc. So just keeping that in mind, 2 of your Q-tips perform 1 extraction. So we're just going to do some extractions around her nose, which is where she's dealing with a little bit of congestion, and then toss them, obviously. And you wouldn't want to perform extractions any more than 5 to 7 minutes on a client. because they can be painful sometimes when you have to do a lot of extractions. And you want your client to not be so uncomfortable that she just can't take it or he can't take it. So, do your best within that time frame, and then you'll be good to go. Okay, we're done with extraction, so we're going to go ahead and remove these disposable gloves and toss them. One thing to note too is you might have to, I don't have a magnifying lamp here, so I didn't bring it in, but if you're doing extractions, you might need the light and the lamp. Probably you will, because it's kind of darker, more cozy in your facial room. So make sure you cover your client's eyes before you turn the light on again. Make sure that there's something always covering their eyes if you need that light before you perform extractions. And then after you're finished and you tossed your gloves, you can tone again. So we're going to get our 2 squares, and we're going to get our toner, and we're going to spray and not touch. And then we are going to move forward to the massage portion of the facial, which is a nice relax after those extractions. Just note, if your client had severe acne, that would not be part of a basic facial. But we don't want to spread any bacteria or cause any more of a breakout. This client does not, so we are going to proceed with the massage portion. And be mindful here that you want to make sure you get enough of your massage product out on your hands before you begin your massage, so that you don't have to go back and forth with your hands in and out of the massage product. That way your client gets that real relaxation, which means your hands will stay on your client's face and neck, décolleté, etc. for the entire massage portion. So they really do get to relax. I'm just spreading it out a little bit so I won't have to go back and get any more of that massage product. So we would be now removing that massage product. And once you remove the massage product, you will then apply your mask. And I'm going to use a brush to apply mine. And like all of our other things that we have applied, we will be avoiding all the other products. We will be avoiding the eyes, the nose, and the mouth like we always do. You always want to read and follow all of your manufacturer's directions for, you know, when you're using different types of masks, etc., and your client's skin type and condition. Everything may vary. So let's say for this mask and my client's condition, it can be skin condition, it can be on anywhere from 5 to 10 minutes. So we're going to assume that that 5 to 10 minutes has already elapsed and it's time for me to remove the mask. So that's what I'm going to do now. after you remove that mask, you're gonna go in for your final tone. So once again, I have my 2x2s. I'm gonna spray my toner without letting the nozzle come into contact. And her skin, of course, looks and feels a million times better. She's gonna be so, so excited. And so here the sun is going down, so we're gonna go ahead and put on eye cream and then a little bit of a more hydrating nighttime moisturizer that doesn't have an SPF in it. She's interested in getting this today, so she'll go ahead and get to see what it feels like on, which I think is a great thing. So I'm gonna take a teeny bit of the eye cream and I'm going to be applying it with my ring finger. And there's a nice little delicate finger, just a little bit of eye cream. We're gonna place it on the zygomatic arch and the brow bone, light tapping. Get it on there for her, and then that way she won't have to do anything when she goes home. Just put her jammies on, basically hang out, and she'll be ready for bed. And then we're gonna get that moisturizer we talked about. That would be an excellent one for bedtime. And it does not have the SPF. We do currently know that she is using a great SPF moisturizer during the day. So she was very interested in getting this one. So we're gonna go ahead and have that on her, as we know it is now dark out and she can go on home with herself ready to go, and then she'll be able to experience it, smell it, feel it, and just fall in love with it. And lastly, we need some little lip hydration, of course. So everybody wants to see how beautiful and moisturized their lips are, and then we're going to do a final sweep on her to close out the facial. And then we present her gorgeous skin to her, and she's just in awe because she's just glowing. And she's so, so, so happy. So we're gonna go ahead and give her some privacy and let her get dressed. And we'll meet her out in the consultation area so that we can review her maintenance, her aftercare, get her booked for her next appointment, kind of go over what we saw in the facial as we were discussing all along. Going over that home care regimen, making sure she's filling in the gaps with her products, making sure she has everything she needs. And that may take a minute to do that. So we're gonna close that sale, we're gonna get her booked and get her checked out and on her way. And she's thrilled and excited to come back for her next service. So we need to get back to our room and clean up because we have additional clients. So what are we gonna do? We're gonna go right back to that room and we're gonna identify any single-use items that we have not thrown away. Go ahead and toss them. We're gonna get our dirty implements and put them in a closed container that's labeled to be disinfected. We're gonna take all these dirty sheets, strip the bed, the towels, we're gonna put it in a closed container until it's time for laundry. And then we're gonna identify and find a proper cleansing agent. We'll read and follow manufacturer's directions for mixing and usage. Mixing it all up, we'll be able to wipe down our workstation and area, removing any dirt and debris. Then we're going to be identifying and grabbing a disinfectant that is bactericidal, virucidal, fungicidal, and EPA approved for use in a salon setting. That's going to require another pair of disposable gloves, so go ahead and put those on. Before you do that, you're going to read and follow those directions for mixing and usage and or using appropriate aerosol disinfectant, and then you're going to disinfect electrical equipment, store it in a clean area separate from other implements. Now you're ready to go ahead and wash your hands before we get to the next client and get set up for the next client. So go to the sink, take those gloves off and toss them, go to the sink, wet your hands, get that coin-sized amount of liquid hand soap and wash your hands down to your wrist. Wash the back of your hands down to your wrist. Go ahead and wash your fingers and the back of your fingers. Fingertips need to be cleaned as well as nails. Wash between your fingers and your thumbs. You're gonna wash your thumbs. You're gonna wash your wrists. And you're gonna do all of that interlocking wash for a minimum of 20 to 30 seconds. When you've got everything good and clean, you can thoroughly rinse under the running water. When you feel like they're properly rinsed, grab disposable paper towels or a towel, turn the faucet off with the towels, completely dry your hands, disposable paper towels go in the trash, Your towel is now dirty. It can go in that closed container with your other dirty laundry until it's time for you to do the laundry, and then grab your 70% ethyl alcohol hand sanitizer, because you need to follow through with your hand sanitizer and do all of those things as far as the areas that you wash with your hand sanitizer as well. And that will be the end of your cleanup from your basic facial, and you are now ready to move forward with preparing for your next client. So that will be the end of basic facial video, and you are now ready to move forward to whatever your next service might be.